So, dear friends, we have started discussing about the chapter number 24 from the Kent's philosophy, again, a continuation of examination of the patient. And certain aspects about the homeopathic case taking we have discussed in last lecture, where he tries to explain that there are two types of symptoms which patient presents. One variety of symptoms are always related with the diagnosis. They are called to be a common symptoms of the patient. And common symptoms are useful only to label the disease. They are the common symptoms of the diseases which are not useful for you for the prescription point of view. They are not the symptoms of the materia medica. But there are other varieties of symptoms which are characteristic enough to individualize that individual. They are not the symptoms of the disease, they are the symptoms of the patient, and those symptoms definitely represents the homeopathic materia medica. They are the symptoms which defines thus very specifically the individuality of that patient, and because of which it is quite possible to find it out a right remedy. So you have to look for both the symptoms. Your case taking should be thorough enough, which can include each and every aspect of the case. We should consider the symptoms of the disease, we should consider the symptoms of the patient, we should consider the complete symptoms of the patient, we should consider the characteristic symptoms of the patient. Everything is important because otherwise you cannot get the whole totality, you cannot come to the right conclusion. And this is what he wants to explain. So examination of the patient in relation with all those aspects are very much necessary when you deal with the patient. So he has given one example that if you are treating a Bright's disease, the symptoms of Bright disease gives you diagnosis, but the symptoms related with that individual gives you a remedy. And this is what you have to look for. So with that point, we have finished yesterday. We'll go start with the next paragraph. All these symptoms have respect to the remedy and to the diagnostic condition. So far as there is a morbid anatomy which can account for symptoms, so much less are those symptoms work as indicating a remedy. If you had no other than such symptoms, you could find no remedy. So he's explaining if you don't get symptoms which are individualizing, characteristic, which are symptoms of the materia medica, then it is quite difficult to find out a remedy. Just labeling a disease with the name of Bright's disease, labeling a disease with typhoid fever, labeling a disease with malarial fever never gives you any idea regarding the remedy. Unless and until you get a very perfect perfect symptom of the individual, it is not possible to catch a remedy. And these are very, very important things. Further, he said, among the many things that interfere with the examination of the patient are the most important is the case taking of medicines. And having done something, no matter what it is, that has been capable of changing the symptoms. Very commonly, the patient will present himself in doctor's office and after giving long array of symptoms, will relate that last night he took a dose of calomel or 2 days ago he took a dose of quinine and he thinks he is no better. And now he applies to you for the relief. In acute diseases, this is very bad and may interfere with the findings of the homeopathic remedy. Very often, the general state collectively, both drugs and disease symptoms in very acute condition must be prescribed for, but in di- chronic disease, the plan is different. See what he is explaining there are many varieties of patients come. Sometimes patient comes with cough and they have given or they have applied the Vicks over there. Someone have applied the tiger balm over there. Someone have taken the fumes of Vicks Vaporub. And what happens? The symptoms gets obscured. You cannot get the characteristic symptoms when such things have been applied. And this is what he criticized that if you want a clear cut picture of the patient, then you must know each and every detail. And if such a thing is happened, then you might not get a clear picture. Many times it gets obscured, and the rough symptoms or common symptoms will not decide or give you the exact remedy. The symptoms that arise after taking a dose of powerful medicine are not indicative to the remedy. They are confusing. They present no true image of the disease, and hence the physician has nothing to do but wait and at most administer a well-known antidote to the drug taker. So if such a patient comes who has already applied some allopathic medicine, who has already consumed some allopathic medicine, and if he comes to you, then whenever you have to prescribe, you have to wait to come out the characteristics. Because the picture is hidden, the picture is obscured because of allopathic medicine. And that picture, if you want to get cleared, then you have to wait. Or either if you know the proper antidote for the allopathic medicine, that at least you can do. Both the things are necessary in order to understand exactly the real picture of the disease. Sometimes he must wait a considerable time until the symptoms reveal themselves and express the nature of sickness. It is just as bad where the physician himself is a bungler as it is where the patient has taken the drug. The confusion arising from bad prescribing is just the same as that produced by the patient's drug. There are physicians going about who will mix up their cases and continue to prescribe for their own drug symptoms and who never have idea of waiting for a true image of the disease to develop itself. Drugging is only a matter of changing symptoms and masking the case. And this happens many times in your practice. Many patients come to you where they have been drugged with allopathic medicine and the symptom picture is totally obscure. You cannot get a clear idea. Unless you get the clear picture, it is not possible to come to the right remedy. So these are very essential things one must understand, one must get the idea. And that's why one must wait for the symptoms to come out again. Waiting is a very good answer to this. And let's see what happens, what which are the symptoms which appears, and then you can catch a remedy. The whole aim of the physician is to secure the language of nature. If it has been masked by the medicines, it cannot be secured. Any meddling will so affect the aspect of the case that the physician cannot prescribe. And the physician who does this meddling must inevitably be driven into the bad methods or into allopathy. So if you are using allopathic medicines in between, you are just obscuring or making hidden the original symptoms of the patient. And if these are hidden, then it becomes rather difficult task to reach to the right remedy. I have looked over the work of bad prescribers and have wondered what on earth they could see in homeopathy to attract them. They do not cure folks. They have no cures to the present. The patients cannot be satisfied by these things. It is true that once in a while, a strong, vigorous, robust patient, when he gets the homeopathic remedy, will go on getting well through a maze of symptoms, changing and drugging, and so that in spite of this meddlesome practice, he will recover. The patient in that case knows not what remedy to attribute it to, for he is given a great meaning. And this happens with many neophytes or many practitioners who just utilizes the many drugs for the patient, and this drugging itself obscures the patient's symptom. You cannot reach to the right remedy, and if you are not able to reach to the right remedy, you cannot cure. Many times these patients complaints persist for months together. They never gets completely settled because you are just drugging and drugging those patients again and again. The physician in that case knows not what remedy to attribute it to, for he has given great meaning. But only the most vigorous constitution will stand such homeopathic dwelling. Some vigorous patients, after getting the homeopathic remedy, go on and get well in spite of their indulgence in the wine, in eating, etc. It is wonderful that what their own powers will do in throwing of the disease. And he has given one more example. There are many patients who used to consume wine even after taking your medicines. And because of their strong constitution, they recovers from that acute attack. Because acute attacks are generally self-subsidized. So this is what you have to understand. If you are able to catch all those things, then it is possible to get a right remedy. But if you don't wait and if you hide those symptoms with allopathic drugging, you don't have any weapon to fight against it. Here you have to catch a right remedy, and that right remedy can be possible only when if you get a clear cut set of symptoms, characteristic symptoms of the patient. And this is what is needed in patient. In next paragraph, what is said? In ordinary cases, however, we see no such thing. Confusion is brought about at once if the physician administers another medicine in place of administering placebo. At times, a patient will present himself, and you will be able to get true image of the sickness by ascertaining all things that occurred up to a given date. Upon that date, he says, I took some medicine, and most of the symptoms subsided. That lead to another image from which you can gather nothing scattered has been taken place. The symptoms may cover page upon page, and yet what remedy do you see? None at all. It looks as if a number of provings of drugs have been mixed up altogether, intermingling symptoms here and there without any distinctness. No individualization is possible. Now, up to that date, the symptoms you gathered may be just all that is necessary. So what he is explaining? He is explaining you the thing that many practitioners goes on changing the remedy off and on. They gives one remedy, then second remedy, then third remedy, then fourth remedy, and this happens many times. And because of which they goes on changing the remedy again and again, and the picture becomes absolutely messed up. You cannot get a perfect picture and you cannot individualize that case. Then it is quite difficult to treat that case completely. So this is very important to understand. You must give medicines in such a manner that you have to, if you have to wait, you have to wait. You should not go on changing the medicines off and on. Changing the medicines off and on creates a jumbling. When you prescribe remedy, wait for some and let us see what happens. Let us see how it reflects. Once it starts reflecting, then you will get the clear idea about the patient and right remedy. So changing number of remedies always creates a problem. So it makes the drugging, over-drugging. They lead to another image from which you can gather nothing, a scattered has taken place. The symptoms may recover page upon page, and yet what remedy do you see? None at all. It looks as if number of provings of the drugs had been mixed up altogether, intermingling symptoms here and there without any distinctness. No individualization is possible. Now, up to that date, the symptoms you gather may be just all that is necessary. Up to that date, the symptoms present the image of the remedy, which, if administered, may yet act, though sometimes it would fail at first because of the confusion. But after waiting a little, it will act. After the administration of the remedy prescribed upon symptoms in the past, I have known the remedy many times to go on acting. Again, I have known that remedy to fail entirely. In such case, wait a while and then order will begin to come. That remedy which was indicated previous to the drugging will act. Suppose a physician comes to you and say, and up to a certain date, I was able to hold this patient's symptoms in order with Tuja. But then the symptoms seems to change and I gave such and such medicines and have never seen such good results in prescribing as I did up to that period. You must give him Tuja again and in this way take up the thread that it was lost, where it was lost. Examine the image of the case where the order was lost, because that is where the same image must be found. On the contrary, the symptoms and inconveniences which exhibited themselves previous to the use of medicines or several days after their discontinuance give the true fundamental notion of the original form of the malady. And here he gives again one example. There are many patients who used to change the remedy. For example, he has given the example of Thuja. The physician was treating the patient with Thuja and patient was improving. At a certain level, there was no further improvement. And then this fellow had changed the remedy. And thereafter, whatever the improvement was there, that was also lost. Now this physician comes to a senior physician and he asks, yes, this is what happened. Kent says, it is the time to think about Thuja again. Because the case was lost at the Thuja and Thuja was acting clearly. You have to check the whole picture again. And many times you will find that patient was indicating only Thuja. You have to just wait for some time and which you have not waited. Then give again Thuja and picture will be clear. And this might happen. This happens many times with such a way. And that for that purpose, patience is a very important quality which you have to develop when dealing with the follow-ups. When you deal with the follow-ups, just wait. Ask the patient to wait. Yes, it will subside. Take at least a day or two. Then patient's complaints automatically vanishes. But what happens? The patient is impatient, and because of patient, we become impatient, and that the problem many times creates the problem. Thing is. Then he further says in next paragraph, this is the idea. Get the original form of the melody. Do this. To do this, at times we have to trace through a mass of difficulties and conditions to get back to the original form of the trouble. But you must get there because you will see that in the beginning, this melody, in accordance with the all laws of divine providence, must have conformed with some remedy that had been created for its cure. The symptoms at that time stood out indicating this medicine. But since then, there has been nothing but confusion, nothing that can be tied to, nothing that can be examined. It appears to have no relation to anything. Very often, we can take up thread and get back to the remedy that was clearly indicated, even 20 years before. If that remedy was indicated then and was not given, the cure was possible by that remedy or a similar one is the only thing that to be considered. That is the only remedy in the case. Since that time, the patient has been continual turmoil from the action of drug. Because it was 20 years ago, there is no reason that you should not think of that drug. The patient's disease has not been cured. It has only been changed and modified. But it is the same patient and same sickness and requires the same medicine. If the disease has been complicated by drugs, however, you cannot always get the action of that medicine which the patient needs for the disease per se. But after the drug have been antidoted, you will have to give that very medicine that you figured out and he will be cured. So he's giving one more example of it. What he is explaining, many times such types of confusing cases comes where lot of drugging have been already done. Many medicines have been prescribed. And because of giving lot of medicines to the patient was not getting cured. He gets obstructed at certain level and patient is not getting cured. In such types of cases, if you want to treat, you go back again to the original history, even though it may be 20 years back. Take that history, find it out what is wrong with the patient at that time, find it out what was the remedy, find it out that remedy. Then you compare state of the patient. If there are symptoms which are because
Low
of
voice, sir.
if there are symptoms, hello, just a minute, hello, hello, hello,
Still low voice, sir.
just a minute. Edi- Hello. Hello. Are you getting voice now?
Now
Yes, sir.
clear,
Now
sir.
okay.
Okay. So now, if patient has been treated 20 years back, you just take that history, find it out right remedy, and with that right remedy, you can treat that patient. But if there are symptoms which are because of drugging, then you have to catch those symptoms, antidote those symptoms with the help of proper antidote, or wait for some time and give that original remedy. And many times that remedy will work for the patient forever. This happens many a times. And this is one example. So, in when you are dealing with the patients in the follow-ups, don't be impatient. Take the history, find it out what is happening, see the reactions. If the patient is reacting, but gradually, wait for some time because remedy has its own pace. It takes some time to act. So it should not be a hurry in treating or in follow-ups. And this is what he wants to explain regarding the follow-up. You should be wait and just go on finding it out what the patient defines. Just listen properly. And this is too important. Many a times, many people goes on changing remedy every follow. This should not be done. If you are damn sure about the remedy, go on changing the potency if needed. Go on higher scale or lower scale depending upon the state of the patient. But don't change it immediately. And this is too important. If you have repertorized case, if you are sure about the remedy, wait on that remedy for months together. That will be useful for you forever. We'll finish one more paragraph of it. It is necessary also to observe the changes all along the line of progress, to know the disease at its beginning, its earlier manifestations, its later symptoms, and its endings. You find, say, most violent neuralgic pains along the course of the nerves in an adult patient. And for these, you administer remedies until you are tried and get only temporarily. But you discover that it is in his childhood he had an eczema, and you will find it looks like mesothelioma. Now you study the mesothelium and it see its violent neuralgias are similar to those of your patient. The administration of the mesothelium cures this neuralgia and brings back the eruption that he had in his babyhood, and he goes on to the recovery. Without getting that view of the old scald head, you would not have been thought of mesothelium. So he has given very good example of mesothelium. Yes, many times it happens we consider mesothelium as a only skin remedy, and the eruptions are very typical with the mesothelium. It is the thick scab under which the pus is collected, is the characteristic of mesothelium. But we never look that mesothelium is the remedy for neuralgic complaints. Neuralgia is very clearly covered under the mesothelium. But we forget because we make it fixed in our mind, mesothelium skin remedy. And that's why he explains, if you take the history of the patient properly, and if you go to the back, you'll find that in the childhood, child had eczema, and that eczema is looking like a mesothelium. And then you open the mesothelium from your mater medica, and you'll find, yes, there is this mesothelium also has a neuralgia. And you give that mesothelium for neuralgia, neuralgia is covered, and the original symptoms which were suppressed a way back reappears. And if it reappears, it is a very good sign. Then you treat that patient either with mesothelium or some other remedy, depending upon that state of the patient. So these are things which he has given. These are very practical hints which he tried to explain over there. So um, we'll finish one more paragraph where he completes that. Or instead of mesothelium, sepia may have had the likeness of that scald head, and he may now have the most striking and characteristic symptoms of sepia. For behold, the little things that have been put into such a turmoil by bad drugging are under sepia, and you put your patient on sepia, and these last appearing symptoms go first, and eruption comes back upon the head and behind the ears, and sepia had cured him. When these things are seen one after another in everyday practice, the physician must begin to wonder if there is not there some truth in it at all. We all as sure as you live. If you practice faithfully, carefully, studying your cases at greater length, gathering in everything that was in the beginning, your cures will be striking, that the multitude will come to you to be healed. You cannot place too much importance upon the masking of the patient's symptoms by medicine, by improper repetitions, or by dosing careless. So he is giving you the hint. You should not go on just drugging the patient with number of remedies. You don't try to mask the symptoms, which will be not useful for the patient to recover. You go into the depth of the case, understand each and everything of the patient, find it out a right simillimum which covers the whole aspect, the past history as well as the present history of the patient. And then it is possible to get a right remedy and right that remedy will cure the patient. He has given two examples, one example of meserium, another example of sepia, and these are the two good examples he has tried to explain. And he has mentioned over there how one should be patient with the patient. That is very important quality. Specifically, if you are taking the follow-ups of the patient, you should have, you should develop that patient. So that's all for today. We'll finish up to on this line, and tomorrow we'll meet to conclude this second chapter from the examination of the patient in tomorrow's session. Till that period, thank you. And tomorrow in the evening, we'll have one more remedy, Ipecacuanha, very close analog of the antium tart in today's sessions at 8 o'clock. So thanks everyone being there, and we'll meet at 8 o'clock with Ipecacuanha. Thank you.